To fight fentanyl, experts believe you have to meet it and tackle it head on. Daryl Porter used to use drugs, but now helps counsel users on how to do life, well, differently. Here's that story. Viewpoint Health Counselor, father, advocate, titles Daryl Porter fully embraces, but his newfound attitude is on the heels of an old addiction, one that was sucking the very life out of him.
I'm a person in long-term recovery myself. And what that means to me is, I haven't had to alter myself from the neck up to get through a day in almost over 20 years now.
20 years ago when, simply put, you got what you paid for.
You've got cocaine that's getting cut with fentanyl. Meth is pretty much everything is getting cut with fentanyl. And now you have pills coming across that almost look like candy that's being pressed with fentanyl. And so when I say the landscape has changed, it really has.
Sergeant D.C. Smith heads up the behavioral health unit with Gwinnett Police. The unit pairs police officers and Viewpoint Health clinicians together. The teams of two tackle calls when a person may be experiencing a mental health crisis.
I mean, we're out of the pandemic, but that caused a steady flow of mental health issues within families, within a family dynamic, within children. You have the stress of college, you have the stress of finals. You have all these things compounding and people just looking for a quick fix.
There's a big correlation between mental health and fentanyl right now. On the mental health side, the pandemic definitely did a number to society, right? So we were seeing a lot of mental health cases before, but now it's just unprecedented, the amount of mental health issues that we're dealing with. And a lot of it is due to the pandemic. Most people have some kind of underlying characteristic of mental health issues or illness, and the pandemic brought those out.
And Smith says if an overdose results in death, the trickle-down effect can be crippling.
When it's too late, the best we can do is offer the family resources. We offer them grief counseling. We offer, anything we can to help them to get through this tragedy.
A tragedy Gwinnett mom Tasha Edwards knows all too well. Her daughter Brianna accidentally died from fentanyl after being led to believe that half of a pill she took was Percocet. It wasn't.
So a person who overdoses, they're aware of what they're taking. They just take too much. These kids are being poisoned because they don't know what they're consuming.
One way to get people to know what they are consuming, Porter says, is to get through to users with hard data and facts before they become a statistic.
I think it's more difficult to survive the disease right now. If I would have relapsed on alcohol, if I would have relapsed on, methamphetamines, the likelihood of me overdosing and dying in 2002 and 2003 or, 1999, minuscule. And here's the thing where it gets tricky. For people, if you're in early recovery and say you haven't used any opioids, you haven't had any fentanyl in your system for 28, 30 days, actually now when people, if they were to relapse, they're at increased risk of overdose and death.
And in Gwinnett County, the system is supportive because hope is just a phone call away.
I think that recovery is possible. I think it's important that if you've got a loved one that is struggling with substance use, that to give some hope that recovery is possible, recovery is available, treatment options are available, and you don't have to do it alone.
Narcan is now readily available. Narcan is the medication that reverses the opioid overdose. There is a way to support our communities. There's a way to curb the tide. I do believe that.
Viewpoint offers outpatient substance abuse disorder treatment services for residents across the region. There is also a court services program for those who are required treatment by a judge. Either way, advocates say there's no cookie-cutter approach to healing.
We really try to make sure that our services are individualized for the people that come with different needs.
We're starting to get more funding so that we can have more access to effective treatments. And part of that treatment is, formerly you would hear people talking about MAT treatment, medication-assisted treatment. Now you're hearing more mild medications for opioid use disorder. And that's something that's really new. And new for Viewpoint, but we have actually, over the past couple of years, have started and implementing some MAT services as well.
What's the answer?
And that's what's hard, is because we don't know the answer. I mean, we can't control really what's coming in from the outside. We're not going to be able to go to these other countries and stop them from pushing it in here. It's going to get in. It's always gotten in. But it's trying to get the people here to not want to take it, to worry about their lives and the fact that this is going to have fentanyl in it, and it's today the day I want to chance that.
There is hope, and it can be done with an entire community rooting you on. On the next and final episode of Fighting Fentanyl.
And anybody that's interested in using the drug for like a recreational high just has to be aware that that's a huge, huge risk.
My solution is really, we need to flood our community with naloxone so that when these overdoses happen, that someone has this life-saving medication that will reverse that.
We bring all the resources in one room to talk about the crisis that's not just crippling the county, but the country. Until then, I'm Deborah Tuff.